Okay, it's time to head back out to Beachwood and find out what Natalie's up to.
Back with Dr. Goldman here at Beachwood Plastic Surgery, but I do have to say this is more of, it's not just a surgery center, it is a medical spa.
Yeah, so you want a comfortable environment, you want an aesthetic environment, but part of my job is to sort through the myriad of tools and devices and products that are out there to find what works, right? So if patients are going to come, they want to do something that actually produces a change. And some things are expensive and some things are not so expensive. Either way, you want them to work. So
And depending on your level of comfortability of what you want, something like this, a hydrofacial, is right up a lot of people's alley, I would think.
So this is basically a device that is also fairly well known nationally, but we've had it for a long time. And it suctions the skin while applying sometimes serums, sometimes light acids that will help get debris off the skin. And basically, it's a wet microdermabrasion that really removes debris. And when people are done, their skin looks hydrated, and that effect lasts a few days. And it's been something that has had very high satisfaction rates. So over time, we try to identify the devices and the products that produce more lasting, effective results.
It's like a fun house. There's rooms everywhere you go here. We have another room right next door that has another treatment session going on. What do we have going on in here?
Okay, so this is a microneedling, all right? It's an array of tiny needles that vibrate in the pen that Stacy's using, and basically it's minor trauma to the skin. So you'll actually see little pinpoint bleeding. It's done with numbing medicine on the skin, so most patients will have no pain.
She's
Some
not even
patients
flinching.
will have a little pain. Are you feeling any pain, Shelley? It's all right, so it's pretty relaxing. But this can be used to treat acne scarring, fine wrinkles. It may help some serums or other chemicals lightly penetrate the skin to produce a rejuvenating effect. So really this is also something that has gained a lot in popularity, but there are multiple devices from multiple companies, so our job is to identify the ones that seem to give the best results.
And clearly with what you're seeing here, you have basically such a wide range of what you can do. I mean, anything from
anything cosmetic,
scar,
surgical, non-surgical, spa, there's a whole array, and I want everybody to be able to get all of that here in one place.
Now, I know on top of it too, we're going to go back into the surgical center soon. Now, there's so many benefits to being able to have surgery done here on site, say, versus a hospital.
Okay, so it's all about when somebody's getting any medical treatment, surgical, non-surgical, safety as well as results. So in plastic surgery, cosmetic procedures are literally done more often in outpatient centers than in hospital centers. And really the game is how many procedures are done, right? So whether it's a angioplasty or a facelift, you want to be in the place where lots of them are done, because the whole team associated with that process is used to doing it, right? So whether it's nurses who assist us in the OR, nurses who recover patients, anesthesia people, they all have to know that inside and out and be used to doing it. So anesthetics are literally more efficient in this setting for something like a facelift or a breast augmentation or a rhinoplasty than in most hospital settings.
It's interesting to hear all of this. And again, if you have any questions or you're seeing this and you want to learn more, we have your website at the bottom of the screen here for people to check out.
Great.
And consultations are always probably a good thing too with you too.
Yeah, so again, people do a lot of research online, but ultimately it comes down to the interaction with the doctor, with the nurse, with the team.
All right, so we're going to be back here again. We're going to take you through the surgical center a little bit later on, but first we're going to take a commercial break, and we'll see you after this.